Right, one of the biggest criticisms and headlines we've seen from the Democrats, the mainstream media, and they're all singing from the same song sheet is the Medicaid cuts. 16 million people are going to lose their health insurance automatically. It's as if like tomorrow they're going to be cut. And we went and looked at the so-called cuts, and it's Washington speak in terms of cuts. I mean, nothing ever really gets cut, right?
Right.
What they did was they slowed the growth. The spending is actually still going to increase on Medicaid, and we're still going to be well above pre-COVID spending levels on Medicaid. We simply slowed the increase a bit. Help explain some of that, because I feel like the White House and Capitol Hill hasn't done as good a job at helping people understand what's really happening and why it needed to be done.
Yeah. So first of all, ironically, even though this is something that Democrats have been attacking, it comes from one of the most popular parts of the bill. When you survey people, because to explain what that is that we are putting a work requirement on people who are able-bodied and working age, right? So not children, not very old people, not people who are sick, but if you are a working age person and you want to collect, nobody's being forced to get a job, but if you want to be able to be part of a free government healthcare system called Medicaid, that I also just want to say that's not Medicare. There's no cuts coming for our, like the old age Medicare, the old age supplied Medicare. This is Medicaid, which only goes to low income people. And one of the things we said is, look, you should, if you are able to work, you should be working if you are getting Medicaid. And a lot of the numbers about how many people are going to get thrown off are actually kind of made up. A lot of these people will rationally choose to go get a job. The numbers that they come up with assume that that people like are incapable of registering that they have a job. And by the way, a lot of it is actually self-attestation. There have to be checks every now and then, like once a year or twice a year.
Mm-hmm.
But mostly what people need to do in order to stay on Medicaid is go online or dial, if you don't have a computer, dial on your phone a number, and it'll say like, press 1 if you have a job, and you'll press 1, and that will keep you on Medicaid. So it's not very hard to meet. We have very low unemployment. Look, if unemployment was at 10% right now, I would say it was kind of cruel to tell people we're going to kick you off Medicaid if you can't get a job, because jobs would be hard to get. Jobs are not hard to get. We have very historically low unemployment. 4.1% is very close to everybody who wants a job has one. So what we're saying is if you want to be on Medicaid, you should, and you are able-bodied and you have no dependents, like you're not taking care of some sick child or you're not taking care of a child or a sick grandparent, you are actually able to work, you should be working. That's immensely popular.
It's not even full time. It's a 20-hour a week requirement, and it doesn't have to be a paying job. You can volunteer for 20 hours a week. So it's really about getting these people out here who are able-bodied to contribute back to society. It's the old saying, you shouldn't get something for nothing. And so volunteering is giving back too. It's not just about going out and getting a paying job. And frankly, one of the most popular presidents, Bill Clinton, is the one who originally put in a work requirement that Democrats all supported.
I mean, look, FDR had work programs, right? Like when during the Great Depression, his solution wasn't just hand out money to people or hand out free things. It was, let's put young men to work. So getting people to work is a good idea. One of the reasons it's so popular is exactly what you said. People who work very hard, pay for their own healthcare, don't mind poorer people getting some help with healthcare. They do mind people who are able to work but refusing to, getting free healthcare from the government. That strikes people as morally wrong. And it's, by the way, it's not just that you can volunteer, because you can volunteer. You can also take classes. You can be in training. Even just looking for a job will count towards the work requirement. So if you're going on job interviews, or if you were just doing job searches and you can document that, that counts. So it is not, we are not telling people, you have to like go work in the salt mines, and like this is going to be really hard for you. You can meet it in all sorts of ways. And frankly, one of the reasons it is so popular is that most people's moral intuition says, as you said, you shouldn't get something for nothing. You should be contributing. At the very least, be making an effort to make yourself more valuable to society, to yourself, to your family, to your community, by doing job training, by volunteering, by searching for a job. The fact that the Democrats are objecting to this, I think it actually shows how out of touch they are. This is the, hands down, other than the cut on the tax cut for overtime, tips, and Social Security, this is the most popular part of